Hi everybody, I'm Laurie Cadden, and we are here at the beautiful Sabre building, or Green Ridge Healthcare Center in Green Ridge. Go figure, right girls? We're here because we are starting our season number 3 on, let me tell you the exact program it is. What's the difference between skilled nursing and a nursing home? Very, very two distinct things, important to know. This is funded in part by CHS, and it is done through the Lackawanna County Medical Society. And our good friend Mark McGlory is behind the camera once again at ECTV doing his thing, and I have 2 lovely ladies joining us today. We have number 1 to my far left, Brenda Conlon, who is, let me get it, Brenda, Regional Director and Business Development and Marketing for Sabre Healthcare.
Correct.
Am I on it?
That's correct.
Good. And also we have Sheila Leo, who is the administrator here at Green Ridge Healthcare Center. This place, when you pull up, is beautiful, girls, I just have to tell you.
Thank you.
Many times before, out here is the patio where we know you do wonderful parties for so many nonprofits, and it's always been a good thing. So I've been here a couple times for that, and a few visits to people who have stayed here, and I have to say, this is totally unsolicited, but you need to know that everybody who I know who has had a loved one here raves about this place.
Well, thank you very
So
much.
good job, okay? So let's start a little bit. Brenda and Sheila are going to give answer a few of these questions. Again, it's very important to know the difference because some people don't get that, and that's why we're here to educate you. So the first question I'd like to ask is, what exactly is, Sheila, what exactly is skilled nursing care?
Skilled nursing care is the health care facility that we bring in residents that will need therapy to be able to go home, to get them to a better level of care, to possibly go to assisted living or personal care home if they can't go home. But we have a whole nursing team and doctors that help care for them here to get them better to be able to go back out in the community.
So Sheila, would you say then skilled nursing is sort of the beginning to figure out where you would go from assisted living to or any other type of living? Is that sort of determine where a patient can go at that point?
We do a lot of level of care with the residents here. When they come in, they're usually very sick. They come in usually straight from a hospital. So we're finishing up their care from a hospital. And then from there, we'll look at them and see exactly what we need to do for them to send them to get them the most success back out in the community.
So then skilled nursing, the difference between that and then what assisted living is, explain the two to our folks listening.
A skilled nursing has more nursing staff. We have a higher acuity of residents. That means that they're a little bit iller. They have usually more difficulty with mobility. So we have the therapy, we can give IVs, we're doing a lot of things that you would have done in a hospital nowadays. Your assisted livings will take residents that are sick, but usually they have more independence. They still are able to pretty much function on their own, but they just need supervision with taking their medications and possibly a little things with dressing. Now,
can skilled nursing, assisted living, and then nursing home, is that the trend to keep everything in one location these days, or is it specific, are there specific buildings for each?
That's an interesting question because a lot of people don't understand it. A skilled nursing and usually nursing home are one and the same.
Okay.
They actually, what happens is in a skilled nursing home healthcare center like Green Ridge is, we have people that will stay here for the rest of their life because they are too sick and they have too many ailments to be able to go back out in the community for whatever reason. A lot of people that have been very successful out in the community and then they get sick, they can come get rehabilitated and then progress to a step down, which is pretty much your assisted livings. And then they don't have as much nursing care, but they are still being supervised.
Okay. So then, Brenda, could you, and I know people are going to, they ask this question to me, to other people. Once you come into a nursing home, can you ever leave? I mean, I don't mean leave to go out with your family, obviously that's true, but do you ever see folks come in and rehabilitate or get so much better that they can go back to their normal life, or does that rarely happen?
Oh no, Lori, that happens quite often.
Okay.
We don't have that stigma anymore of long-term care. You come in and you come here and this is your last place. That's not how it is anymore. We see patients who come in, get rehab, they get therapy, and they're able to go home to the community, the next level of care, but definitely not. They're not here for the rest of their life.
So then what type of medical professionals make up a skilled nursing team?
Well, we have our medical director at Greenridge Healthcare, which is Dr. Nick Dodge. He comes here. We have him. We have our director of nursing. Of course, we have our administrator, Sheila. We have our therapy staff. We have our activity staff. We have social services. We have activities. We also have dietary, correct? And we have a whole maintenance, housekeeping. We have
Because you have to run it like anything else.
correct,
It's a
like your
huge
home,
facility.
right? Because this is basically their home while they're here.
I have to tell you, when Mark and I pulled in, I know I should have just gone to my left, but I went right, and I thought I'll park over on the side. Well, of course, there was no. So we went all the way around the back till the little gravel road, and I thought we're going through because I know it's going to go. So Mark followed me. But this place is gigantic. I mean, I know I've been in here, like I said before, but it's big because we were going around. I'm like, when is this going to stop? So lots goes into making this place run efficiently and well, obviously. So, Sheila, when would you say there comes a time when people, children, loved ones, need to talk to their parent or parents about the possibility of going to a nursing home? When is it something that you believe through the regular, I'm just in general, not someone who was hurt, but somebody is aging, when do you think it's time? What are the signs that something might be up that they need to do that, or consider it anyway?
That's probably one of the hardest questions that you're asking.
I love to ask hard questions.
I see that.
I'm teasing.
Because it's a very hard subject for families to have.
Sensitive, it's so sensitive.
It's a very sensitive
You don't want to hurt
subject.
their feelings, that kind of stuff.
And you're also looking at taking somebody that has, like I always say, it's a circle of life. You come into the world needing all the help in the world. And now we're taking somebody that we've made totally independent, raised their own children, and now they're becoming more dependent and possibly needing to come back into a facility to be cared for.
Yeah.
And that is very hard for anybody to accept in their lifetime. But I think when you start seeing them that they're falling at home, when you have realized that they're not making their meals and they're not having, making good choices and good decisions, it takes, the whole team to really look at everybody at their house. I look at my own aging family, and we've had to do that for my own parents. And, I had to make the hard decision with my brothers and my father to have to put my mother into place because of those decisions.
And it was just your mom.
It was just
because
my
that's
mom.
the problem too. If you're still fortunate enough to have both parents,
Absolutely.
one of them really needs more help and the other one is trying to help them. It's hard on that person to be able to help them in the manner of which they should be.
What we have found, and if you look at it statistically, a lot of times the caregiver actually ends up
Worse
getting
than the one they're
worse
caring
than
for.
the one that they're caring for.
Or they go first and then there's no one left.
Right. And that, we didn't want to see that happen to my father, so
Right.
we made the decision with my mother, which was a good decision at the time.
Was she fighting you about it? Do you feel, I shouldn't even ask that personal. Do most people fight the decision?
Most people do fight it. Every time we try to lose our independence, and if
Yeah.
I come up to you and I tell you today I'm taking your driver's license and you're not allowed to drive anymore,
Yeah.
what would you say?
And you're the child doing that, right? The roles are
Absolutely.
reversed, so that's very difficult.
It's very hard.
Yeah, but once they come in here and they see their quality of life is increased and their partner, their husband, their wife has a better way of living too, it probably eases that. Do you see the difference then after they're acclimated?
I do see some of that. You do see that with the families. They do acclimate. They come in, they start seeing that they realize it is better for mom and dad, but they are getting a better quality of life. They see mom and dad eating much better. They see them engaging and not sitting at home alone just in front of the TV, because we do a lot of activities here. I'm a strong believer of having them outside on a patio or taking them out for a walk. I love when families come and take their loved ones out. I feel that my activities needs to have them out. I like them to go for 4th of July fireworks. I want them to have cookouts. We do it with the staff. So I make the facility, that's one thing that I like doing, is having the facility very involved with our residents and doing things as a big group. We do shopping sprees with our residents. Of course, it's only the ones that are able to go along and
some can't.
do some. Some can't, but for the most part, we'll shop for any of them.
And what happens when it is the decision happens, and say it's a single parent, and they're deciding between their children and themselves, yes, I'm coming to this nursing home. I'm going to be here. We've made the decision. We move. How much of their personal belongings, what they've loved and cherished through the years, how much can actually they bring? Whatever fits in the room, or are there limits to things like that?
Well, we do have to limit it, of course.
Yeah, because it's a smaller
But there
room.
is a certain amount of space that they do have, and we always suggest to do like photo albums and books and things that they can hang, and personal cards, things that can bring them back to their memories. It's, the memories of their life are very important, and it's something that we like to look at too. Even with our activities, we try to find out what was the resident involved in at home. In one place I've done car shows because we've had males that enjoy the antique cars. So we've asked antique car dealers to come and put their cars out for showing, and the residents get to go out and see them. So we try to get the interest of everybody, but we like them to bring personal items to have them so that they can feel at home and make it more homey for themselves.
So Brenda, this is off script, but just because of what you do and what we're talking about here, it's a perfect segue. Then you're working for SABRE, so how does one know how to choose the right nursing home? How to, from your standpoint, you're trying to market this. This is one of the best places you can be. And as I said, anyone I've ever heard, it is. So when people are making those decisions, they're crucial decisions. Do people shop around in general for that? Is it word of mouth? And how do you best put forth the efforts of these companies for people to understand this is a good feeling, that they should be here because of the administration and everything else that goes on in a building like this?
Let's see. Well, first of all, we have 7 buildings in our area that I cover, and a lot of times it's word of mouth. They may have had a family member here. They may have had a friend stay here. And good reviews, of course, of the facility is a very positive thing when marketing. A lot of times families choose location. If there's a husband and wife at home and they're elderly, a lot of times they don't want to travel to Scranton.
Far, yeah.
Right. If they're from the valley, they don't want to travel to Scranton, or they don't want to go, further down the line. So a lot of times it's location and convenience for the family. And like I just mentioned, a lot of times word of mouth is a huge thing. And when I'm out in the hospital seeing patients that needs placement, a lot of them, the family members already have in their mind which facility they like. They come and tour. We give tours 24/7. It doesn't have to be arranged. You could just show up anytime. Anybody could give a tour here, and it's nice to see the location where your loved one is going to be. So it is a hard decision, like Sheila mentioned, but once you see the buildings and you see the care that we give, it makes it a lot easier for them.
2 things I like that you just said. If I were someone looking to put someone I love in a nursing facility, number 1, you said without an appointment and any time. And the reason why that's important to me is obviously during the day, lots of stuff, lots of activities, so you could say, oh, come for this. But at night it can be scary. It can be scary anywhere. It's scary in my house. I hate the dark. But that's why I sleep with the door open as much light as possible. But I think that's important, and without notice, because if you set something up, okay, everything's going to be this. So I like that. I think that's a good way for people to know and feel comfort that, hey, even the people who are already here, like they're allowing that to happen, this is a good thing. And yeah, I would assume that is something that is always, that has to be ingrained in your staff. You're caring for the loved ones of so many people. The importance of that. And because of everything that's out there, I mean, it's a big responsibility, Sheila, and for you to get the people into the right place.
And then I look at it too, as if I was placing my mom or dad or my grandparents in a facility, I would like it to be a facility that, that has a good reputation.
Right.
And
Well, obviously.
yeah, exactly.
Knock on
Yeah.
wood.
So, you always want to make sure that you could tour the facility at any time. You could speak to the administrator, speak to the director of nursing, speak to really any one of our department heads. We're always willing to talk to you, and because it's a big decision, like Sheila said. I mean, it's not an easy decision.
And the safety measures that you have to have in place and all those things. I mean, do you guys, and I don't know this, I assume it because you have to with state regulation and federal regulation, drills and all those things that you have to have all of these things in place, right, Sheila, to just be making sure you're in compliance.
Yes, there's a lot of drills, there's a lot of policies in effect. We are the highest regulated industry next to power plants, nuclear power plants. Wow. So when you look at nuclear power plants...
I was going to say child care, honest to God. That's what you would think.
Hospitals are nowhere near regulated as we are. We are as highly regulated as a nuclear power plant, and depending on the year and what's going on, could be either power plants or the nursing home. But yes, we are the...
Wow.
So our regulations are very in-depth, very deep.
Stringent, yeah.
Very stringent. We look at...
I mean, it makes sense, but power plants and nursing facilities.
Well, you have to
Nursing
realize over the years and why these things have come into effect is because of the abuse of the elderly.
Yes, absolutely.
And you hear about it almost every day on the news, which is sad. And it's so unacceptable because these people have worked hard, they have lived
their
good
whole
lives.
life, yep.
And sometimes you sit back and you think, well, they're just old and whatever, but you start to realize when you get into their background that they are some of the most educated people you've had. It doesn't matter who they are. We're all going to grow old, and we've been very well educated, but by the time you get Alzheimer's or you end up in a nursing home, people don't realize and see that part of you.
When an emergency does arise, or if it does, what happens in a situation? Just give a basic example of something that may happen. Like, what happens in a fire drill? Let's just use it in that. What would happen?
In a fire drill, when the fire alarm goes off, all the doors get closed. We go through, we mark the rooms that no residents are in so that the firemen know what rooms that are empty. We work at getting everybody out of the facility and making sure that everything is shut down and safe. And we account for every resident. And when you take only the residents, you're also taking med carts and also the charts because you have to have all their records. So that's all going with them or getting locked up behind doors.
And then once you're out there, is there a checklist? Okay, you have to, right? How else? You're human beings. How else are you going to do it?
Well, we account for our residents constantly because you've got to worry about elopement.
Right.
We do have residents that have, that want to seek to leave, and you have to account for them. We're responsible for them for 24/7.
Of course.
So, little things that you don't think of because we think they're adults, but a lot of times it's almost taking them back to a 2-year-old. You're always accounting for your 2-year-old. You're always trying to find them.
It's that circle of life, right?
And it is the circle of life, like I said at the beginning. So you're going back to that.
I just thought of this while I was talking because the romantic in me thought about this. Has there ever been some kind of romance that has happened here with any of the patients? Because it would make sense, right?
Absolutely. We have had husbands and wives that have come and lived together, and they're very much permitted, and we allow them to have their times together. And for their privacy, provided that both of them are still sound mind and safe, they have a note hung on their door, and they're not bothered during those times.
I love it. I love that. I think it's neat, but what about people who have, you always hear these stories, so I'm thinking it happens everywhere because, like I said, the hopeless romantic. You go to a nursing home, you need a little help, and you're a widow and you're a widower, and any connections here? Like we could have some match games or
you can.
Because you do a lot of socializing. Hey, and the women have it made because there's so many less men than women, right? Because are the residents more female than male here?
Yes. It's almost everywhere like that.
You know why? Women rule, baby.
Yes, we do.
Yeah.
Yes, and then we do have those relationships. As long as they're both capable,
You're fine.
we're fine.
I love
It's,
it.
you know, so they are allowed. I actually had a wedding at one of my facilities for them.
See, I know, this is the
So,
stuff you hear
you
about.
know.
I love it. I think it's so cute.
It's great.
So couples can come live together if they're both in need, they can be here. So tell me a little bit about, because that's very social, what are the favorite social things that go on? I'm sure you have probably music and holiday parties, and everybody feels comfortable, right? Because on Christmas, some people can't always go home to their loved ones, and this place never shuts down. So they must look forward to those kind of things, right? To make it as normal as possible.
We do. We do a lot of things, like we have had a Christmas dinner, or what we call a holiday dinner, between Thanksgiving and Christmas, and we invite the families to come in and eat with each one of them. We'll have, I'm a very strong believer that everybody should have a gift to open up on Christmas.
Yeah.
So I always make sure that everybody has at least one gift to open. We do usually a giving tree, so residents that will get a gift from somebody, and all the staff will pitch in and buy for all the residents. We have the elementary schools, or the brownies.
Do you have pen pals here with the kids at all? Is that something you do?
There's not really pen pals. That might be something I can have activities
See?
look at. See,
it is.
I'm always open.
Well, because you're so close to some of the schools,
Right.
and those children love to connect, and what a way to bring them together with the older population and these young little whippersnappers.
And they do come, and the children come. We welcome the children
Oh, I
here.
think
We
it's
love
great.
it. And they will sing, and they will do activities with the residents, and the residents adore it. And it really gets some of the children an advantage to be with elderly people that they may never experience in their life, because some of them aren't fortunate enough to have the grandparents that have aged and things like that. So it's nice to have children come in, and you see the residents lighten up as soon as the babies come
Absolutely.
around.
Sure. And so tell everybody too, because we didn't touch on this, I think it's important to close everything out, but the cost of skilled nursing and nursing homes, are a lot of them, are they privately funded? Are they, how's one able, generally, I know there's all different scenarios, to be able to come into a nursing facility?
Well, there's a few different type of payers. There's a private pay. There is an insurance, if your insurance has...
Like a long-term health care plan?
You can have a
something like that?
long-term care health plan, or your insurance, so that if you're in a hospital, they will pre-search you to stay so many days to get therapy and things like that, and then they're expecting you to discharge home. You can be Medicare, which the insurance and the Medicare kind of run on the same basis, and then you have your medical assistance. So once the funds start to run out, then you apply for medical assistance, which is a lot of paperwork and very tough. But it's good for children to start to understand where your family's things are, so that when you have to do that process, it makes it a little easier.
And what their right is from being a working individual in the United
Right.
States of America to get some
Absolutely.
privilege at the end.
Absolutely, and it helps.
I know, that's a good thing. Now, Brenda, anything else that because since Sheila was holding the mic, we just went, I didn't skip some of my
That's
Brenda
okay.
and Sheila. But anything else you'd like our viewers to know about this type of work?
It's very rewarding. It's a very rewarding job. I mean, we help people 24/7. When I'm out in the hospital seeing referrals, and they ask me about a facility, and I'm totally honest. I mean, if I would put my parents here, I would definitely put you here.
Yeah.
And all the 7 facilities we have, I would put my mom or dad anywhere. It's just a genuine relationship you get with these patients and these residents. We call them residents because they're
They
part of
are.
our family. They
Yeah,
are.
yeah.
This is their home. They
Right.
reside here, whether it's short-term, long-term.
Well, and it's interesting too, because when you have residents that live here, when somebody does pass, it's amazing how much the staff break down.
Yeah,
Because
sure,
they
because they've gotten
are-
to know them, yeah.
They have gotten to know
They're like
them.
family, you become
They're
family, you're the
absolutely-
extended family.
Absolutely.
And I've had staff go to their services outside and things like that.
Yeah.
They really very much miss the person, because some people do stay for a
Long
little
time.
longer than we think or we would expect. And so you do get to know them, and you become very personal with them, and they know your life and you know their life, and it's
a
great.
good thing.
It
It's all
really
great.
is.
Thing. Yep.
Well, thank you, girls. See?
thank you,
Now,
Larry.
was it that bad, Sheila?
torturous.
She's just saying that. She's just kidding. Well, thank you. Thank you
you,
very, very
Laurie.
much
Thank
for
you very much.
taking your time and doing what you do, because it's a wonderful thing. So I'd like to thank all of you out there for listening, for watching, for being part of the series. This, again, the beginning of our 3rd year, so we thank you for that. And we thank CHS because it's sponsored in part by them. We thank the Lackawanna County Medical Society and our lovely friend Lisa, who we just love. And also, I'd like to thank our dear friend, because we know each other for longer than we thought, right, Brenda?
Absolutely,
Long
20
time.
years.
That's
But
right,
only-
Brenda. And we don't see each other that often, but long time ago. Brenda Conlon and Sheila Leah, who's the administrator. Brenda, who is, I'm going to tell you again, Regional Director of Business Development and Marketing of Sabre Healthcare. And I didn't even look at my notes for that. Did you
You
see it?
said
I
it
got it down.
perfectly right. Thank
So
you.
thank you, ladies. Thanks
you.
for joining us.
Thank
Have a
you.
great
Thanks, Laurie.
great day, rest of your day. Okay, we will see you next time, next month for part 2. I'm Laurie Cadden, and thanks so much for watching.